there's such a race to the bottom when you sell medication to medication, and every clinic thinks they want to be the cheapest. I feel like that's the quickest strategy to go out of business.
I guinea pig a lot of the medications we sell at Olympia. I get a prescription and I'm like, let me see how this is gonna, I just want to know how it makes you feel.
Well, I think, and this is something I'd love to pick your brain on. We just did a consulting call with some clients earlier. There's such a race to the bottom when you sell medication to medication, and every clinic thinks they want to be the cheapest, but I feel like that's the quickest strategy to go out of business, especially now with some of these bigger drug makers come in. What are you seeing as far as like the trends on, semaglutide, GLPs, all these things, and how these clinics are actually doing business?
I don't even know how to answer that question. The GLP-1 rage has been absolutely crazy. So how are they doing it? I know what it costs us to make it, and I know what we sell it for, and what we sell it for to our practitioners. And even if we sell direct to patients at our retail price, it's much, much lower actually than what you could, because I'll go online and I'll find different, and again, I won't say any names out loud, but some of these different sites that are telemedicine companies, and you could just do a Google search, semaglutide, buy online, and you'll find probably a half dozen telemedicine companies. You can go and sign up and do your online consult. But those, what we would charge a patient $300 for, they're paying $800 or $900 for. So there are some instances, especially direct to patient, where it does make sense to go direct to Olympia, because we have partnerships with telemedicine companies, so we can help procure that whole process. But the thing is, the GLP-1s are such a magic bullet for a lot of people that I hate to say the word because it makes the industry sound dirty, but they're being exploited because of the need for it. So you got people who have tried their entire lives to lose weight and can't, and have to go through that whole stigma of being overweight and everything that goes with it. And now you've got medication where it's almost a slam dunk to lose weight. They're like, yeah, I don't care what they get that mindset, like, I don't care what it costs at this point. Just tell me where do I sign up. So it's a double-edged sword. I know people want the results are great, they'll pay for it. But there are, if you do your homework and you're aware of compounding pharmacies, if you're a patient out there looking for something, you could find it at a more affordable price. Even walking into a clinic. I think the places online that do the telemedicine stuff, I think they're the ones that are really exploiting people. And for the group that's probably watching this podcast, it's and it also for us, one of the things I always think of is the reason it's out there so big right now is because the people who are watching this podcast they're getting these people in the door. But you have to think beyond that. Like for us, as soon as we started selling semaglutide, that very same day, I said, what do we do when semaglutide comes to an end? Like, what's our next step? Because and all the business owners should be thinking about that, because at some point it's going to be not cost effective for them to buy compounded semaglutide and be able to make money on it. So you got to think. But the good part is I'm getting all these people into my clinic because of semaglutide. Now the question is, how am I going to keep them? And I think that's what we all have to think about. Because I know at some point when Novo Nordisk, I think, is the one who makes semaglutide, when they get caught up and the FDA says, okay, they're caught up, and the FDA goes, okay, we're taking semaglutide off the shortage list. That's it. As a compounder, we have 60 days to sell our stock, or 60 or 90 days to sell what we have left. And that's it. We're done. We can't do it anymore. So now those people have to go back to the manufacturer and pay the big bucks. So.
Well, you said two things I want to touch on. One is, with a lot of our clients, we talk about, I think weight loss, like you said, that's the biggest disease in the country. And so it's this broad catch, but what's interesting we've seen is people don't know the other conditions they have. And so for instance, and I'm not a provider, but NAD is a great, I love NAD. how many people that are coming in that are overweight possibly could have depression or have some things or some anxiety disorders where NAD could help. And so if you use your weight loss to bring people in and screen them, you can offer so many more things and keep them longer, because eventually they might lose the weight or eventually they're done. But once they know what you do, so I think to your point, it's a great gateway, but it's not the only answer as well.
Yeah, and another part to that is, let's say semaglutide doesn't go away for 3 years. I think it's going to go away much sooner than that. But let's say 3 years. So you have somebody that comes in, they're 300 pounds and they want to get down to 200 pounds, and they start taking semaglutide, and now they get down to 200 pounds in 6 months, or 6 or 8 months, 9 months. Then what happens? Now you're the clinic owner. You help this person reach their weight loss goal, but now they're done with semaglutide. So what do you say? Okay, hey, thanks, yeah, thanks, Justin. Appreciate it. Glad we could help you lose weight. You're no longer a customer of ours. You're gonna ride off into the sunset with having been successful in losing weight. But the business owner, I'm like, well, what else can I do? What else can I do for Justin after he loses his weight? Like what ongoing therapy? And I tell people, if you think you're going to take semaglutide, lose 100 pounds, and then say, okay, I'm at my goal weight, and stop taking semaglutide and stay at 200 pounds, you're probably fooling yourself, because once your appetite comes back and that kind of stuff. So as a business owner, as you're working with those patients, you need to be building a rapport with them. You need to be building a relationship with them, so that when their semaglutide journey ends, their weight loss journey continues, because you want to keep them on. And that's why Olympia we have our weight loss kits, we have our vitamin injections, like our Lipomino, our B12s, our MIC, all those things that efficacy wise aren't as efficacious as semaglutide in such a short time, but they do help. They will help keep your patient, keep that weight off once they end the semaglutide or whatever GLP-1 they happen to be taking.
Well, I'll tell you from the mix shot standpoint, I think, and this is just everyone out there, we've had a lot of success helping clinics market by doing an intro and just say, come and do a mix shot. I mean, the cost on them is so low, but anyone that raises, and they don't know it's a mix shot, so you call it a skinny shot or whatever. But
Right.
I think the big point of that is it doesn't matter what you market. The goal is once they come in, then you educate them, because they don't know the questions to ask. We've been training our people this last couple months just to say, hey, while you're here in your semaglutide program, if you get sick in the next 4 months, you're coming back here for an IV. Like, but they don't even think to say things like that. And so the person doesn't know, if I'm sick, I can come in. So you have to get them in for what they want and then educate them on the back end.
Exactly. And with with semaglutide, one of the things like we do, we also we're semaglutide can be in most cases, like when I talked about the online stuff earlier, those pharmacies or those telemedicine doctors are selling directly to the patient. The patient takes it home. They inject it each day or once a week on the semaglutide. And that's great for the patient, but for the business owner, you lose like if you're a business owner, you're a brick and mortar, you have a patient come in, you prescribe them semaglutide, they go home with the semaglutide, they do their injection once a week, and you barely see them. You've taken away the opportunity to build that relationship with the patient. So when they're done with semaglutide, they're like, okay, I'm done. I haven't heard from Dr. Justin in a couple of weeks, and but we did semaglutide. We did we were later to market with semaglutide because we did all the stability testing and all the other testing we had to do to bring it to market as a 503B product, which means we could sell it to patients for prescriptions, or we can sell it to businesses to use it for office use. Now, what the great thing is about semaglutide for office use is it's a once a week injection. So if I get patient Mr. Smith to come in once a week and I give them the injection in my office, you think back to where the HCG days, when HCG was out, there was the same kind of program. But now you have that patient come in once a week. Now you have the opportunity to offer them more things. I know now I guinea pig a lot of the medications we sell at Olympia, because I get a prescription and I'm like, well, let me see how this is gonna, I just want to know how it makes you feel. And I took semaglutide for about 3 weeks, and I felt awful. My energy levels were so low. I was literally sitting at my desk and I'm like, I'm falling asleep, because it took my energy away. But then I'm like, you know what? Let me go ahead and grab some Lipomino and do that injection, which is a B vitamin injection. Let me do that once a week. And immediately my energy came back up. So there's things like that. Like when that patient comes in, how's your weight loss? How's your appetite? Are you doing any, you would be greatly served to get involved with your patient to the point when they don't need semaglutide anymore. And this is a key, this is a big word I'm going to use there. It's a short word, but it's a big word, and that's habits. Helping your patient develop the habits that are that are going to continue to serve them in their health journey after the semaglutide part of that journey is over. And if you build that rapport with them, then they're going to be like, okay, I finished semaglutide. What's next? What's next, Dr. Lesh? Well, we got, we've got the B12 injections, we've got the lipoaminos, we got our weight loss kit, we have our IVs. So all that other stuff, like you can keep those, and those are products that a patient can take forever, to manage their energy, to manage their weight, retain muscle, get them on a workout program, help them build good habits. There's a great book. You've probably heard me talk about this before. It's by James Clear called Atomic Habits. Yeah. Wonderful book, wonderful book. And I think back to my own journey of when I lost, when I was in high school, I was a big heavy set kid, and I got into working out. And as I sit back and look at that, I'm like, all I did was change my daily routine and build those good habits. Now I've been working out anywhere from 4 to 7 days a week, and not 7 days recently when I was younger, but now I'm on a 5-day-a-week program. But for the past 41 years, I've worked out 4 to 7 days a week religiously. But I built that habit into my life. And if you can help your people who are struggling with weight loss to build those good habits, it starts to become easy. And then they go, okay, I've learned how to exercise. I've learned how to eat right. I've learned how to keep the weight off. And if you've built that relationship with them, the next question is, well, what's next? What else can you've helped me. Thank you. You've helped me achieve a goal that I could not do by myself. What's next, doctor? Like, what can I do next? And that allows you to keep that patient. And on the referral side, it's even more powerful because the referral becomes, if I'm not connected with my patient and they get semaglutide and somebody says, oh gosh, Justin, you've lost a ton of weight. How'd you do it? Oh, my doctor prescribed me semaglutide. I've been using this. I've lost weight. Great. I'm going to go talk to my doctor about semaglutide. All right. Now, if that conversation becomes, if you've connected with your patient and done all the things I just mentioned, and hey, Justin, you've lost a ton of weight. How did you do it? Well, I went to Dr. Dan at Olympia. He set me up with the semaglutide. He coaches me every week. He had me buy this great book called Atomic Habits, whatever it is. And then that person you're talking to is not going to go, well, okay, let me get semaglutide. They're going to go, oh, let me go see Dr. Dan because he's got the answers. That doctor, that business has my answers, not the drug. So you want to make sure that you stay connected with that patient so they become a lifelong customer. And that just helps to have those repeat customers come in. That helps on so many different levels because now you can kind of count on a certain amount of revenue from existing customers every month. You're not as stressed about adding new customers because you already got a base that's sticking with you. So it's a domino effect in the right direction. The last thing you want to do is have a domino effect in the wrong direction, and then you're out of business. But what we need to help people do is build that domino effect in a positive direction. So everything just kind of snowballs. And then from the outsider looking in, they go, oh, well, that's easy. It's really not. It's not easy. It takes a lot of work. But if you have the foresight to think about what's my patient going to want after they lose that weight, then all those pieces start to come together. Well, what else can I offer them? Well, how am I going to offer that to them if I give them semaglutide and tell them to go home for the next 6 weeks and do an injection a week? Now, are there going to be patients who are like, I can't come in, Justin, I can't come in once a week. I live 45 minutes away, or okay, you got that. But you're going to have a good core of local people. Come in once a week, chat with us. Let's weigh you. Let's do your body fat composition. I just spoke to somebody this morning who bought those machine scales where it scans your body, tells you how much body fat and all that. And that's a great way to keep people coming back and say, hey, let's chart your progress.